Hello, I am Blair Fisher, and this is my group, Jasmine Anderson, Q Chambers, and Katie Johansen. Our presentation is about the Franklin County Prevention Coalition. So this is just a map of Tennessee and all the 95 counties. There's Franklin County located at the bottom, and there is a nice little arrow pointing to it so that you can see it in relation to the rest of the state. And so just to give you a quick history of the coalition, it did begin about 12 years ago in Franklin County. They serve the 7 cities that are within the county, which is about 45,000 people. Since then, when they began 12 years ago, they've been working with the community to gather stakeholders and community leaders and other resources to just kind of build up their coalition to better provide intervention for people that are suffering from substance use within the Franklin County area. So the mission of the Franklin County Prevention Coalition is that it really brings partners and communities and families and institutions and leaders together from the community to reduce youth substance abuse and violence through education and prevention intervention in Franklin County. The vision aims to reduce substance use and abuse and violence for future generations and involve educating community members and creating environmental change and solutions for the problems their community is currently experiencing. So here's a few of the sources of financial sources that they have within the coalition. And then I'm going to talk about some of the mandates that are required of them from these sources of financial gain for them. So the first one is the Office of National Drug Control, and it's a policy actually. So it provides funding and coordinates with local community coalitions since 1997, as a matter of fact, to really strengthen community supports and efforts to decrease specifically teen substance use. The coalitions have to engage many parts of the community, which the Franklin County Coalition is very good at doing. And it has to holistically address the issue of teen substance use among teens. So it calls on community leaders to involve them, so that way the coalition is better educated on how they can be reaching and intervening on behalf of these teens. And the coalition really does that by educating parents, providing education within schools, and really talking with teachers to intervene on behalf of these teens while providing peer support groups as well that teens can be a part of. Another at the state level is the State Tennessee Department of Mental Health and Substance Abuse Services Block Grant. So this block grant specifically provides funding for prevention, treatment, and recovery support services and activities for people who are at risk or have substance abuse problems. So there has to be evidence-based and culturally responsive programs for family systems to be impacted. And these family systems are experiencing difficulties with drug use and substance abuse. And it has to involve children of incarcerated parents, children in foster care. The coalition specifically does this through their Bridge program, which involves children in all of those categories. This block grant also requires that they work with law enforcement and create policies that really reduce the rates or create less conducive environments for higher rates of substance abuse. So Jessie, who is the director, she is a trained TIPS educator. So she's talking with local restaurants and providers of alcohol and tobacco, educating them on signs of, on proper ways of checking ID and making sure that no underage people are consuming alcohol or tobacco. There's also another program called Count It, Lock It, and Drop It, which is involving pharmaceutical companies to educate their workers on using on using safe practices and making sure that workers are being safe when working with certain prescriptions, and making sure that they're looking at the signs of addiction among people that they are administering the medication to, and also encouraging people to safely dispose of their medications once they are done using them. And then there's the regional level, which is Lifeline Peer Project. This program specifically wants to reduce the stigma surrounding substance use disorders and provide greater access to peer-led community groups. So they put different people who are representatives of this project in different regions. So Alan Burnett is the representative for the coalition, and he's listed on the list of staff, but he is able to educate people in the community. He, as a representative, has to be able to start self-help groups such as Narcotics Anonymous, Alcoholics Anonymous, and then other self-help groups that might be useful to people who are suffering from substance use disorders. And then on a local level, there's not a lot of funding that is provided on a local level, but specifically for this coalition, there's none. They partner with a local shop called Soul Shop, which is a clothing/shoe store. And so they have partnered with them to get their information out to other people, so that way they can be utilized as a community resource tool. And then they rely highly on local donations as well for monetary support. So the issue at hand really is that the poverty rate is really high in Franklin County. It's 14.8%. 18% of children are living in poverty as of right now in Franklin County. There's high rates of substance use and opioid use and overdoses that are taking place in Franklin County. And a large part of the problem is that it is a rural area. So it's not a concentrated area of use within like a specific community or area. It's widespread. So it's located in, it's not really taking place at these big parties or in clubs. It's at bonfires, it's at creeks, it's on people's personal property. So it's kind of hard to monitor and or police that as it's taking place within the county. And also going back to the poverty rate, higher rates of poverty increase stress levels among people and can induce unhealthy coping mechanisms to deal with those high levels of stress. So, sorry, I'm moving us so that way y'all can see. The goal of the coalition itself is to lower the levels of substance use in Franklin County, Tennessee. And here's just 3 different areas in which they are truly doing that. So they're trying to educate people in the community about substance use disorders. They're doing this through parenting classes. They're doing teacher in-services. They are, like Jesse is educating law enforcement about proper ways to, how they need to police different areas. So that way they have higher patrols in certain areas, so that way they can cut off parties and be monitoring more carefully on prom night, graduation night, those big event nights. They are, and she's also educating other people in the community. They're giving support to those currently struggling with addiction in their family systems. So Bridges, which is the after school program they provide, which, like I said, involves all of those groups of children in foster care with incarcerated parents who have behavioral issues. They're giving support to these children and their families. They involve the parents and caregivers. They are providing programming that not only targets the kids in after school and tries to provide intervention for the problems they're experiencing, but also is wanting to incorporate the parents, give them parenting classes, and give them effectual ways to interact with their children. So that way they can see the signs of mental duress, mental illness, and intervene, and also know about how the different factors of their lives might be impacting them, just to kind of provide early onset intervention and give them healthy coping mechanisms. And then they provide interventions that help create healthy coping mechanisms, like I just said, and support for vulnerable populations. You know, there's higher rates of poverty, and so this entire county really needs the support from the inside, from people who know that community specifically, these community leaders that are invested in creating a better tomorrow for these kids and their families, and just people in general who are suffering from substance use. And so some of the, excuse me while I move us, factors affecting the coalition, like I said, it's rural, so it's a widespread issue. There's a lack of resources within just Franklin County itself, even though the coalition is providing a lot of different resources. Environments in which substance use is taking place, like I said, is different. So it's not in these big clubs, and it's not in specific areas. It's widespread and on people's personal properties. The coalition admitted that they have not performed any community assessments, but they are going and speaking with people in targeted communities that might be experiencing certain issues. that they are trying to prevent. They are collecting data from schools, presumably for their state level and federal level grants and funding that they are receiving. And then another thing that they have going against them is religion. So people consider substance abuse a taboo topic, or mental illness is a taboo topic. But the coalition is really trying to work on that as far as opening up people's minds and helping them be mindful that everybody's experience is different and valid, and that everybody deserves proper intervention and evidence-based help and care, and trying to get better and feel better themselves.
Thanks, Blair. So when considering the organizational structure of the Franklin County Prevention Coalition, it most aligns with a social change organization. So as you guys may know, social change organizations tend to go against the status quo. They exist to create change. There are several factors that are specific to social change organizations. They typically are involved in social movements and social reform, and they are developed so that they can respond to a community's need for change. So with our coalition, you won't see as much social reform involved, but you do see them adapting to their community's needs. And you can go to the next one, Blair. There we go. So the organizational structure with a little bit more detail. So considering their operating mechanisms, they have quite an organized operational structure. So in order for social change organizations to accomplish their goals, they have to focus on best practice standards. So this helps to create stability and control within organizations. So that might mean that duties and tasks need to be clearly distributed, and they are focused typically on activist activities. Sometimes conflict and competition can arise between competing interest groups because the ideas can be radical and controversial. But typically, when the community sees a coalition trying to decrease substance use in adolescents, it's not a super controversial issue that people might oppose. So when discussing it with the coalition, we didn't have a lot of feedback about competing interest groups and things. So there are some specialized roles within the coalition itself. They have roles such as a director, a project coordinator, an overdose prevention specialist, a bridge program coordinator, and staff who work with youth, staff who work with the judicial system. So we'll also see a lot of involvement and education with the law enforcement in the community. So having these specialized roles really helps to create change to reduce substance use and abuse in the younger generations in the community. And then when it comes to our group specifically, we have found over this project and the last project that having these roles really helps in our organization. So that means that some of us, we've learned, have some strengths that are different than others. Some of us have a strength for research or outreach, while others may have a strength in delegation and maintaining structure. So it's really important to learn about these things when working with groups, coalitions, at your job, anything like that, because it does help to achieve goals. And you can go to the next one. All right, so the model for change. So as I said before, it is a social change organization. So the coalition operates within the realm of a social planning community organization model. It involves experts in the substance abuse field and identifies at-risk populations. As a group, we thought it would be beneficial for the coalition to transform into a social action model. So while they have some similarities, we did think it might be a useful transition for the community. So that would mean that they are very task-oriented and that they hope to decrease substance use in the county. And if they were to expand their coalition to other areas of Tennessee, we would likely see a larger movement to decrease substance use. And this is pretty much typical of a social action model.
All right, thanks, Katie. Okay, so now how do we recruit people into the coalition? How do we get them involved. As Blair stated and Katie both, we've learned about the Franklin County furthermore and how rural it is. So understanding the community's culture, I think goes a long way. Some of these strategies could be street outreach, flyers and tabling, such as like at grocery stores, the pharmacy, personal contacts. So people who are already in the coalition could help and reach out to others. Word of mouth, that can go a long way in rural counties. Meet and greets and luncheons for professional staffs, bring in some of the other agencies. Okay, and next, Blair. So in the recruitment, we want to look at some important stakeholders that would be key in mobilizing the community. This could include law enforcement, academic institutions such as the K through 12 schools and the University of the South, the healthcare system and professionals, the city mayor and county mayor, local community businesses, the community itself, people who are affected by addiction. And then also the state entity of the Tennessee Department of Mental Health and Substance Abuse Services. Next, Blair. All right, so once an evidence-based practice has been chosen, there are several ways to implement the strategies in order to meet the goal of the group. First, we'd want to develop an action plan for the intervention. And then this is where we could use the recruitment and outreach and see what resources that the community has, that the coalition has in the community. And also where those interventions can take place. That would be very helpful. A suggested intervention that we come up with was a collaboration effort with the University of the South through the AmeriCorps VISTA program to assist in the commitment of reducing youth substance use within the community. Next. So looking at the leaders in the coalition, we have Jessie, who is the director. So she oversees the operation of the coalition, from programs and planning to engaging and collaborating within the community. And then we have Alan Burnett. He is a project lifeline coordinator who oversees 13 counties in his district. He speaks about his own personal experience with recovery while trying to reduce stigma and increase self-help groups in the county. And then we have Lindsay Conrad, who is the Bridge Program Coordinator. She assists children and families who are experiencing behavioral or substance use problems. Next. And then we have Melanie Morrow, who is the Youth Engagement Coordinator, and Barbara King, who is over the Drug Endangered Children. She focuses on community-based partnerships for multiple disciplines to support children living in drug environments. And then we have Dustin Ritchie and Matt Brown, who are the Regional Overdose Prevention Specialists, and they provide training and education on overdose prevention through naloxone trainings throughout their district. And that's it.
Thanks, Jasmine. So as it relates to community concerns, the Franklin Prevention Coalition, they look at data, they look at surveys, they look at overdose rates. They talk to law enforcement and school administrators. They also get reports from the state, and they review those reports to see kind of where they are with the concerns there. Also, they have town hall meetings where they gather and they talk about the issue at hand, and then they also attend conferences. So as it relates to cultural issues, it's a diverse community. So the coalition includes everyone in their meetings. So everyone in the community, everyone in the neighbor, you know, they talk to law enforcement, they talk to, like I stated before, school administrators. So they try their best to include everybody. Also, any certain population that they're targeting, they'll go and talk to them. For instance, if their target population is youth, then they'll go out and talk to those youth as they're implementing certain things with the community concerns and the cultural issues in the community. Their whole thing is not leaving anybody out at all, but making sure everyone is included. Go ahead, Blair. All right, so as it relates to how they document their progress, so the Bridge program is for grades 3rd through 8th, and some ways that they do this, they monitor their grades, their disciplinary issues in school. They monitor to see if they're going back and forth before the judge for the substance abuse issues. Also, they track their individual successes. They also use surveys as well. So this is how they create percentages as a whole. So as it relates to the prevention program, they use surveys and they measure their thought process. So they may ask questions like, do they think that using drugs is harmful? How often are they using drugs? Do they think a person who uses drugs, are they like a bad person? And then as it relates to student surveys, they use a student survey, but the whole goal is not to use it as like a school survey. They kind of can get the bulk of their kids and kind of get the bulk of the data when it relates to tracking the progress with the students using a student survey. So they use grades 8th, 10th through 12th, and then they look at risk factors and protective factors such as and in this process they ask a series of questions like what is their school involvement, what is the parent communication surrounding drugs, how are their parents feel about drug use, how do they feel, how often are they using, and then the location in which they're using. And they pretty much use these things to kind of track to figure out what the need is, what concerns that they have, so they can figure out a way to address those concerns. Next. All right, so as it relates to the sustainability, making the outcomes matter, what ways they can continue to make impact. Like I stated before, their whole thing is about making sure everyone is included in the community, making the community feel a part of something. So if they're doing something, they figure out ways in which they can partner with individuals in the community. They create mutual relationships. And with talking with the director, I know she talked about there are certain things that they can and they cannot do, but they try their best to make sure that everyone is included and include everybody in what they do.
And that's our presentation.